All the bones of the human body are not built in the exact same form. There is lots of similarity, like, in which bones we're finding compact bone and where do we find most of the spongy bone tissue. But because of their different size, different positions, different roles that they have, it is also okay to divide all the bones of the human skeleton into following categories. First one, and we're going to spend a little bit of time also illustrating it, is a group of long bones. Obviously, one of the three dimensions has to be far greater than the other two for a bone to qualify as the long bone. Then a group of short bones where essentially we're talking about their length, their width, their height being about the same. So we can imagine them in the form of some kind of not really geometrical cubes, but bones that would remind us and resemble to a certain extent of that term, smaller cubes. Then we have bones that clearly don't fit into categories of long or short bones, and they are best to fit into a group of irregular bones because they really would not have almost any of the characteristics that we would see on either of the long or short bone group. After irregular bones, we would also need to consider certain bones being classified as flat bones. In this case, please do not take term flat just the way we take it in everyday conversation, because the flat bone is actually sometimes quite significantly curved, so it doesn't have any ideas of being flat. But anatomically speaking, flat bone is the bone which is composed of two layers of compact bone, between which we see the core part of the bone being spongy bone tissue. Those flat bones are, for example, bones that make the skull cap. Also, our ribs are flat bones. The flat bone is also sternum or chest bone, and many more. Long bone would be bone that we see within the arm, within our forearms, within the thighs, or within legs. And of course, short bones are those ones that we will see also in just a variety of different places within the body. They're like in the root of the hand, group of 8 small carpal bones, or in a rear part of the foot, we're going to have a group of 7 tarsal bones that are all classified as short bones. So short, long, irregular, flat, and the last group is composed of bones that are called sesamoid bones. The sesamoid bone is actually not a bone which resembles so much the sesame seed, although that is what the name would point us to think. Sesamoid bones, anatomically speaking, are those ones that are embedded into a tendon of a large muscle. One good example of what a sesamoid bone is patella, the kneecap, and it is a bone which is embedded into a tendon of quadriceps femoris muscle. For the clarity of presentation, I believe that we should address some of the findings that we're expecting to see on a typical long bone. So let me go and quickly share the screen in order to see this particular diagram. So we're going to start with this, and we're seeing here typical long bone, obviously humerus bone of the arm, which has been cut open twice. At the center point of its body, it was cut open in a transverse plane, and the upper half of the bone was additionally cut using the frontal plane. So on the left side of the screen, we can see that we're naming different parts of the long bone, such as centrally positioned body or shaft or diaphysis. Then we have opposite side ends, the proximal and the distal epiphysis, which really means the end. And in between diaphysis and the epiphysis, there is a part of the bone which is known as the metaphysis. Although metaphysis is pointed out here as this segment of the bone, which you can see between proximal epiphysis and the shaft, I think that it would be much more accurate to point out what really represents metaphysis is on the cross-section seen as the epiphyseal line. This is where part of the bone was cartilaginous from birth all the way to the end of puberty. And that piece of cartilage actually enabled our bones to keep growing in length. At one point in our life, usually towards the end of the puberty, the cartilage is unable to resist any longer, and practically bone forces the cartilage to practically disappear. And of course, the closure between proximal epiphysis and diaphysis then result in a formation of epiphyseal line. What else can we see from this diagram? We can see that surface of a bone is definitely made of compact bone tissue, whereas the epiphysis, both proximal as well as distal, are composed practically of a spongy bone tissue, maintaining just the very surface as the compact bone. The reason for that is mechanical. There is much more of a physical resilience and physical strength that spongy bone tissue demonstrates comparing it to compact bone. And because bones will make the contact with each other through joints, obviously most of the stress forces will be experienced by bone at the point of its contact with another bone, in other words, at the joint. Of course, to make the joint, bone will have to have specific part of the bone designated to make the joint. That's why it's called the articular surface. Articular surface generally becomes covered with a cartilage, not necessarily just articular cartilage as this diagram illustrates, but rather a special type of cartilage that is called hyaline cartilage, that is going to be most commonly used for a variety of different mobile joints. Here is the periosteum. As you can see it is also a membrane that we managed to just peel from the bone surface, and we know it will contain dormant osteoblasts and lots of nerve fibers. So if the bone accidentally becomes damaged or fractured, these are osteoblasts that will be immediately deployed into a fracture cavity and will start repairing the bone as quickly as it can be done. At the lower part of the screen, you can see here another articular surface that this bone has. This time it is going to be articular surface for two bones of the forearm, for radius and for the ulna. And of course, articular surfaces must be covered with cartilage to eliminate friction that would otherwise happen between two bones as they move. And like the proximal epiphysis, type of cartilage that we're going to use to cover the articular surface is going to be again the same type, that is the hyaline cartilage.